Hello, everybody. I wanted to present to you today coding guide for providers. Topics are telehealth, medical decision making, subjective data collection, and audit proofing. Audit proofing, assessment, and medical decision making for telehealth. Learning goals in today's presentation will be building an assessment that clearly establishes medical decision making, documenting telehealth visit, clear medical necessity, convert symptoms list into clinical reasoning, and use concise wording that supports coding and audits. Learning goals, clinical example, original provider's documentation, which is a very common statement. Patient has cough since Christmas, body aches, diarrhea, needs MRI, needs labs for cardiologist. So the audit problem here is there's only we only have a symptom list. We have no provider's interpretation. There's medical decision making is not clearly established here, and medical necessity for telehealth is unclear. So the goal is for all of this to be improved. Number one is building an assessment that establishes medical decision making. For example, patient cough ongoing several weeks, clinically consistent with acute bronchitis versus viral upper respiratory infection. History of prior pneumonia increases risk for progression, monitoring, and counseling provided. So, medical decision making formula, what I want you to think about when you're thinking medical decision making. Condition plus your interpretation plus your concern. And that is medical decision making. Okay. Goal number two, show telehealth medical necessity, right? So the auditors want to know, why are we doing this telehealth visit? Okay, what is the medical necessity for it? So for example, your language would be telehealth follow-up performed due to ongoing acute respiratory symptoms requiring evaluation and management, counseling on progression risks, and treatment recommendations. So you just explained why we need this telehealth, right? Goal number three, convert the symptom list into clinical reasoning. Symptoms only, right? So if you're just listing cough, diarrhea, body aches, no. What they want to see is they want to see your clinical reasoning. That's what we're getting paid for. Respiratory infection, differential, bronchitis versus upper respiratory infection, GI symptoms, likely viral process, prior pneumonia history, increases monitoring needs. Okay, so the auditors code your reasoning, not your symptom list. Goal number four, use concise audit-friendly wording. Long but not weak, right? Patient says she is sick and coughing and wants testing. So that will be a weak statement, right? So a better statement, stronger one would be persistent cough with systemic symptoms, likely viral bronchitis versus upper respiratory infection. Counseling provided regarding red flags and escalation of care, right? So strong documentation equals clinical clarity, not more words. So it's not necessary that we have to write all these paragraphs and stuff. No, they just have to include your reasoning, right? Which you're already doing. We just have to, write it down. Okay, so before versus after the upgrade, we have example transformation. So before, patient reports coughing since Christmas, and after, the correction would be persistent cough consistent with bronchitis versus upper respiratory, prior pneumonia history, increases monitoring needs. Key lesson here is same information, stronger audit defense. Okay, so Here are some defensible assessment examples, clinical rewrite including, right? So persistent cough, bronchitis versus viral, diarrhea, likely viral gastroenteritis, recurring sacral cyst, folliculitis versus abscess, and then chronic spine pain, workers' comp, coordination, and cardiology follow-up, labs ordered. So you're explaining each thing you're addressing. So let's go back to how to establish medical decision making, because that seems to be uh, a lot of the issues that we've been seeing. Problems addressed, acute and chronic, risk consideration, history of pneumonia would be an example, right? Management decisions, meds, monitoring labs, and then provider involvement versus administrative note, right? So you want to, for your problems addressed, you want to write specifically what you addressing. Okay. Now, provider involvement, they want to see what your reasoning is, what you're thinking versus just, it can't just look like an administrative note that anyone can write. So, telehealth medical necessity language. Okay. So, the example phrasing, telemedicine follow up performed due to ongoing acute symptoms requiring evaluation and management. So this statement is great because it includes your symptom duration, the risk factors, and it explains counseling and precautions, right? So all of this is included. Now, audit proof assessment checklist. So what you want to ask yourself is, did I state diagnostic impression? Did I include risk or concern? Differential diagnosis, management decision documentation, and can auditor see necessity in 10 seconds. Okay, so just think of this when you're doing your assessment. Now, two sentences upgrade. So this is a bit of a shortcut if it's still confusing. So I want you to think of two sentences, right? The first sentence will include clinical impression and the differential. And sentence number two will include why it matters plus what you're doing, right? So let's go to the next slide and let's go over this. Okay, so sentence number one is what you're thinking is going on, right? So you're going to say persistent cough, likely bronchitis versus viral infection. Okay, it shows providers thinking, it shows clinical judgment. Now, sentence number two, why it matters, what you're doing. Okay, so you're going to say history of pneumonia increases risk, so patient advice on warning signs and monitoring, right? And this one shows the risk, it shows management, and it shows medical necessity. And if you put that together, you're going to have a great assessment, audit proof. Okay? So, key takeaways from today's presentation is documenting your thinking, not just the symptoms. Assessment drives medical decision making, and medical decision making supports billing and audit safety. Consistency equals fewer denials. Okay, thank you so much for your time. I hope this is helpful, and have a great day.